common location for an abdominal aortic aneurysm is inferior to the renal artery and extending to the bifurcation of the common iliac arteries. Repair involves a resection the diseased portion of the aorta and replacing it with a synthetic graft. Based on the anatomic considerations, which structure is most at the risk of the ischemia during the repair of an aneurysm at this specific location. So we have to know the blood supply to the abdominal organs and small intestine, large intestine. Okay, so mostly common places for the formation of aneurysm is there is the abdominal aorta, inferior to the renal artery, and it extends to the bifurcation of the common iliac artery. So it may be formed at this place or the aneurysm formed at this point. So above this point present the celiac trunk at the level of L1, just below that at the level of renal artery, okay, which originate from the side of the abdominal aorta. Here the superior mesenteric artery, and below the renal artery is the renal artery, that is the celiac trunk, and here we have the superior mesenteric artery. Okay, so this is a point below the renal artery where the formation of aneurysm. So and below the point of formation of aneurysm originate inferior mesenteric artery, and the inferior mesenteric artery provide blood supply to the distal 2/3 of colon, so the 1/3 of colon, the descending colon, the sigmoid colon, and the rectum. Okay, so inferior mesenteric artery provide here sigmoid, and suprarectal arteries which provide the rectum. So during the treatment process, when we cut off the supply here, okay, during the treatment of the aneurysm, okay, supply here, so during this treatment there is effect on the blood flow to the inferior mesenteric artery. So in commonly, if we see that there is enough collaterals present which is sufficient for the to provide blood supply to the distal region of colon, transverse colon, the descending colon, okay, but there is very less collateral which provide blood supply to the sigmoid colon in case of the treatment procedure. When the blood supply to the inferior mesenteric artery become insufficient, there are enough collateral are present which provide blood supply to this region, but the most affected area is the sigmoid colon because it doesn't have enough collateral to maintain its demand. So let's see the answers. The ascending colon, no, ascending colon is provided by the superior mesenteric artery, so it is not effect. So sigmoid colon is our answer. Let's see the other answer. The small intestine also provided blood supply by the superior mesenteric artery. The spleen is provided by the celiac trunk, okay, and the stomach is also provided by the branches from the celiac trunk. Thank you.